Hello, everyone, and welcome to Navigating Health Insurance and Support Programs. This Living with Lymphoma breakout session will provide patients with better understanding of how to access lymphoma treatments and will speak to the services and resources available to patients. We appreciate those of you who are able to join us live today. Before I introduce today's speaker, I would like to provide a bit of guidance about the Zoom software. This virtual software does not allow you to share your video or microphone. So if you have any questions, please type those into the Q&A section, and that can be found in the bottom toolbar. Your questions will be read aloud by myself, the moderator, following the presentation, and they will be answered live by our presenter. I would now like to welcome our speaker, Mildred Heans. Mildred Heans is the Medication Reimbursement Coordinator for the Oncology Department and New Brunswick Stem Cell Transplantation Program at St. John Regional Hospital. Mildred is a member of the Atlantic Canada Oncology Drug Access Navigators Association, a network of health professionals working in designated oncology drug access navigator or drug reimbursement positions throughout the provinces of Atlantic Canada. For the past 11 years, she's been helping patients navigate their insurance and helping them find resources to alleviate some financial burden for the medications needed. That way, patients can focus on their health and treatment. We thank you very much for joining us today to help us learn more about this important topic for cancer patients, and in particular, lymphoma patients. I would now like to turn over the presentation to you, Mildred. Thank you so much, and take it away.
Thank you, Lisa. Hello, everyone. As you heard, my name is Mildred. I am the Drug Access Navigator for St. John Regional Hospital Cancer Center. I would like to give a big thanks to Dr. Anthony Ryman for inviting me to present in this conference. Very grateful to share what we are doing in New Brunswick, and especially navigating health insurance and support programs. So, as a medication reimbursement coordinator or drug access navigator, there are 4 of us in New Brunswick. It started with 20-something years ago and followed by me. And now there are 4 of us. 1 at the Moncton Hospital, 1 at the Chalmers Hospital, Vitality, and here at St. John Regional Hospital. We are hospital employee that works on referral from the physician to investigate and coordinate funding for a prescribed drug, not funded by the hospital formulary. So this could be through your insurance, private insurance, provincial drug program, or through the pharmaceutical patient support program, or also we can access the Health Canada Special Access Program. So our functions are different across Canada, but our main goal is the same, is to help our patients access the medications you need. We have you can find drug access navigators across Canada. There's a CODANA group or a network here in New Brunswick, in Atlantic Canada. We call ourselves Atlantic Canada Oncology Drug Access Navigator. And in Ontario, there is a Oncology Drug Access Navigator, and also Quebec and Alberta, and I believe as well as BC. So finding a navigator, you might, in different facilities, our names are different. So some, they call us drug access facilitator, some drug access navigator. I am the medication reimbursement coordinator. Some are medication reimbursement specialists. Most cancer centers have 1. So you can, if you need one, you can always ask for your physicians or nurses or one of your staff to reach one to connect with the drug access navigator. So we have a networks across the province. So to connect with the local drug access navigator, we have a website that I can share to you. So in Ontario, they call Odano, and they have a website, www.odano.ca. They help each other and share resources, which in turn help their patient as well. So in Atlantic Canada, we called ourselves ACO, Atlantic Canadian Oncology Drug Access Navigators, and we were formed in 2018 with the help from Oncology Drug Access of Ontario. So this is our website in Atlantic Canada. This is where you can see a lot of resources. You can find a lot of resources in this website. You can find a DAN. You can find how to apply for the provincial drug plan. A lot of resources are in this site. And this is also for the Odano, and I'm not sure if some of you are aware, but if you want to contact them, you can just go to their website and send them an email. So our topic is navigating health insurance. So how do we navigate healing insurance? So it's always started from the clinic. So the process starts from the clinic, cancer clinic. Referral normally comes from the physicians, nurses, pharmacists, sometimes patients, but mostly from the physicians. So when the doctor and the patients discuss about the treatments, they will contact or refer the patient to the drug access navigator. The drug access navigator will meet with the patient, determine if the patient has drug coverage. This could be private health insurance or provincial drug program, such as in New Brunswick drug plan. So we also determine if medication is covered or requires special authorization. We also find out if the patient has full coverage or if she has 100% full coverage or she has a percentage co-payment. Also, we ask if this patient has an annual or lifetime cost maximum limit on her plan. Those are the things that we actually determine. So the drug plans, drug plan is a program designed to help pay for person's prescription drug expenses. So there are two types of drug plans in Canada. Insurance drug plans provided by private companies. Most people in Canada have insurance plans paid for by their employer called as a group. The other is a public drug plan, which is a government subsidized plan designed to help certain group of people access the prescription drugs. So I'm going to show you, this is a stat that I obtained from Canadian Life Health Information Association. And these are the drug plan memberships in Canada. No plan has 3%, federal drug plan 3%, provincial drug plan 24%, and most 70% has insurance drug plan. And that's from their companies or if they purchase it in their own. So how do we check the drug coverage? So for those who has private health insurance, because it's pandemic, we have restrictions sometimes to bring our patients in our offices. So there's a lot of paperwork back and forth. So we call the patient, we ask them that they can go online or they can call the insurance. We also provide them the DIN number for the drug before they call their insurance. Sometimes they will participate in a 3-way call with us, with the insurer, or a support program. Often, private insurance plans have annual financial caps and co-pays deductible. So this is normally the questions to ask if you have a private insurance. If this drug is this drug listed in my plan? Does it require special authorization? How much of the drug cost is covered by the plan? Are there any plan maximum? Are there any restrictions or requirement in this plan? The reason why we want you to ask is when we do the special authorization and when we enroll you into the support program, we know all these questions and we can tell the patient support program this is what we are asking some assistance from them. So if you have a provincial drug plan, we investigate if the medication is listed in the formulary. And if it is listed, we submit the special authorization and follow up the request. And if drug is not listed, we enroll the patient into the patient support program. So there's different provincial drug plans. In Ontario, there's an OHIP or ODB. In New Brunswick, there are 2 drug programs. The New Brunswick Prescription Drug Program for patients that are 65 years and older who is receiving the Guaranteed Income Supplement, and the New Brunswick Drug Plan who do not have private insurance and have existing coverage with a private plan. However, they have to reach annual or maximum coverage for the drug prescribed listed on their plan for the prescribed medication. Also for the New Brunswick Drug Plan, it is open for any residents of New Brunswick that has no drug plan. So in this plan, there is a premium to pay based on income. And the maximum premium that they have to pay is $30 per medication or per prescription. So there's also Nova Scotia, PEI, and Newfoundland and Labrador Pharmacare. I'm not familiar with the other provinces, but I believe Nova Scotia, they have a top-up program. So if you have private plan and you need I think a copay, you have to enroll into the top-up program, and the Drug Access Navigator can help you with that. So if your drug is not covered by your private insurance, if it's not a benefit, if it's not a prior authorization, if the prior authorization is declined, if the prior authorization appeal is declined, then we will enroll you into the patient support program and we will request bridging or compassionate. So we also going to discuss with you the patient support program. They are privately owned operating set of services, which are usually sponsored by the pharmaceutical companies. Services vary widely from program to program and have different requirements. And what I like about the PSP program is their flexibility. So the services that they offer is financial assistance. This is when your private insurance will cover, the drug covers 80%, 50%, and the program can help you with the remaining balance out of your pocket. The bridging medication is one of, I have enrolled a lot of patients on bridging medication. This is when sometimes the patient loses their private insurance and the drug is covered under the New Brunswick Drug Plan. I will ask the patient support program to cover the drug while the patient is in the process of applying to the provincial drug plan. So compassionate program or compassionate use, this is a drug or a drug that is, you'll be on this drug forever. So they're giving it to you free at no charge. So the patient support program also will help us with a coverage investigation. So instead of us, they will investigate the patient's insurance and find out all the coverage from copay from maximum from deductible. They also provide education materials. So if the patient will need some education materials, they will send it to the patient. They have also infusion clinic. So if the patient decides to go to their private clinic, they have that clinic and they offer it for free or no cost to the patient. And also if your private drug plan requires you to go to the private clinic, they will coordinate that with you and with us. They also have a specialty pharmacy, especially for those oral therapy, and they dispense it and they do the home delivery. So these are the patient support programs. There's an Abby Care support program. There's the MyGen on Care and the Janssen Bio Advance. And there's also AstraZeneca Oncology Patient Support Program. So for Provincial, in Ontario, there is a exceptional access program that facilitates patients access to drugs not funded on the Ontario Drug Benefit Formulary or where no listed alternatives available. In order to receive the coverage, the patient must be eligible to receive benefits under the Ontario Drug Benefit Program. Now, I'm not expert in this exceptional access programs in Ontario because I am located in New Brunswick, but you can find it in this website. So there is a federal special access program. So a federal access program is a program by Health Canada. Physicians can request a drug that is not available for sale in Canada through the special access program. Request must be for treating a patient with serious or life-threatening condition where conventional treatment have failed or unsuitable or not available in Canada. The request should go first to the manufacturer. I mean, before we send request to the Health Canada Special Access Program, we have to get the approval letter first from the manufacturer before we send the request to Special Access Program. So I only did one study, case study, based on what I learned here in New Brunswick. So this is a 75-year-old female with no drug plan. She's been diagnosed with CLL. A physician is prescribing Imbrovica and treatment to start in a week. So the physician has called me and wants to see the patient because she wants to start and there's no drug coverage. So first thing that we do, they consult the patient to social work to help to apply to the New Brunswick drug plan. And then I came to the clinic and I enrolled the patient to support program for bridging. And once that is enrolled, the patient will be approved. Medication will be dispensed by a specialty pharmacy designated by support program. So once the drug is established through the New Brunswick drug plan, and I submit the special authorization to the New Brunswick drug plan, then I update the support program, and then we will transition the patient into the New Brunswick drug plan. Oh, I'm fast. Questions?
Very quick. Okay, well, thank you for excellent presentation and your expertise in navigating drug access programs available for Canadians, and of course, sharing more about your experience within New Brunswick. I guess we can now open the live Q&A session. So as a reminder to everybody on the call, you can still ask your questions. Just type them into the Q&A section at the bottom of the black toolbar, in your Zoom platform, and we're going to answer those questions in order of receipt. So looks like we have a few already, but keep them coming. So Mildred, why aren't take-home cancer drugs funded for everybody?
Sorry?
Why aren't take-home cancer drugs funded for everybody?
So there's no universal drug funding, right? Everybody knows that, I believe. I hope so. So every provinces, they have their own drug funding. So for New Brunswick, we do different, the same as in Nova Scotia, and I believe in Ontario.
Okay. If a drug is approved by Health Canada, why isn't it covered or paid for?
Why is it not covered?
If a drug is approved by Health Canada, why isn't it automatically paid for?
I think that's a good question. Every provinces, they do their own coverage. They actually, for New Brunswick, as far as I know, once the Health Canada approve the drug, some provinces are way ahead of us approving the drug. They review it. I believe they review the drug, and they also set the eligibility criteria.
Okay. All right. What are intentional agreements related to drug access? How do they work, and what would this experience look like?
Sorry, can you redo it?
My
volume is not so.
That's okay. So what are interprovincial agreements related to drug access? That's part one.
So I am sorry, I really have no idea about that.
That's okay. We can always answer that one later as well. Feel free to send any questions that we can't answer today or we don't get to today to info@lymphoma.ca. So we can definitely tackle that one a little bit later. Okay. Any more questions from anybody? Give it a minute or so to see if anything comes through. Okay. Okay, it looks like we have one more. What would you recommend patients do as a first step if they cannot get access to a funded drug? I know you touched on that a little bit, but can you just reiterate that?
So if you can always connect with the Drug Access Navigator. First of all, I should say the first step, the process starts at the clinic, at the cancer clinic. So when the patient and the physician discuss their treatment, they actually, the physician or the staff will refer the patient to me. And first thing that I do is investigate or determine the coverage for patients. And if the patient doesn't have a drug plan, we actually enroll the patients into the provincial plan if the drug is funded by or covered by the provincial drug plan. On the other hand, because the paperwork's involved in applying into the provincial plan, it takes sometimes 2 to 3 weeks, depend on the case. So we enroll them into the support program sponsored by the drug company for bridging access so that they can start the treatment without delay.
Fantastic. Okay, well, it looks like we don't have any more questions. So if you do think of anything, please do email us again at info@lymphoma.ca, and we'd be happy to get some answers to you as soon as possible. So if there's nothing more, I guess we can end a little bit early and everyone can have a break before our closing session. So I want to thank Mildred for taking the time to share her expertise, and I want to thank everybody in the audience who attended today. If you have any follow-up questions, again, email those to us at info@lymphoma.ca. And as a reminder, this session was recorded, so it will be accessible on the Lymphoma Canada website, where you can rewatch it for all the details, as well as the website link. And you will be sent an email when these recordings are available for you to review. So as a final thank you, we greatly appreciate your time and expertise, Mildred. Thank you for joining, everyone. And this is the last live session for the day, so we would like to direct you to the final closing remarks for the conference. Thank you so much.
Thank you for having me.
Of course, anytime. Bye, everyone.
Bye.